This is so exciting. We have so many amazing partners joining us this afternoon, but we're going to go ahead and kick it off. My name is Aurora Harris. I am the Southern Region Director for Young Invincibles, and I lead a lot of our on-the-ground outreach and strategy for the ACA for young people here in Texas, alongside some wonderful partners who I hope are on this call today. I just want to say on behalf of all the partners who put this call on that we are so grateful for your presence today. We're so grateful for all the work that you do to make sure that our communities have access to healthcare. I'm really excited to present out this new funding opportunity and what it can mean for all of us doing this work. Next slide. So today's webinar is presented by Young Invincibles, the Center on Budget and Policy Priorities, Community Catalysts, and the National Immigration Law Center. Next slide. For today's agenda, we're going to have an overview of the Navigator program. So we're going to talk about, what is the Navigator program? What does it look like, historically? What does it mean to be a Navigator? We're going to get the Navigator grantee perspective. So you're going to hear directly from someone who has gotten this grant before and is kind of doing this work. After that, we'll have the grant writer perspective, giving you some sort of tips and tricks to writing the grant, and also, what it kind of takes to apply. And then, of course, we're going to open it up for Q&A. We're going to be using the Q&A box for that. So please don't use the chat. Definitely use the Q&A function. We're going to have some frequently asked questions on the Navigator grants. And then we're also going to talk about two really important things. One is, how do you develop those Navigator partnerships for the work? What does that look like? So we're going to hear directly from another Navigator grantee on how they've sort of developed partnerships through their grant. And then we're also going to talk about what are the reporting requirements if you are to receive those grants, and how can the connector tool support you in that. And then finally, we're going to have another round of Q&A. So it's going to be lots of opportunities to answer your questions, and we're really excited to get started. Next slide. Just a few logistics. I know we are all very much used to Zoom by now, but you all are muted and in listen-only mode. So if you want to ask a question, again, click on the Q&A icon at the bottom of your screen and type your question into the box. We will pause for Q&A during the presentation and in another time at the end. You can also email any of your questions to beyondthebasics@cbpp.org. And of course, this webinar is being recorded and will be available for viewing at www.healthreformbeyondthebasics.org. So without further ado, I'm going to kick it over to Ina, who is going to give us an overview of the Navigator funding.
Thank you, Aurora, and thank you everyone for joining us today. As Aurora said, my name is Ina Rubin. I'm with the Center on Budget and Policy Priorities, and I'm going to provide a general overview of the Navigator program. So first, let's start with some background. Next slide, please. The Federal Navigator program was actually written into the Affordable Care Act legislation. The Navigator program provides grant funding to organizations in order for those organizations to help people get covered. And it was officially launched in 2013 with $54 million allocated to the program. The original focus of the program was on helping people enroll in health coverage on healthcare.gov. Now, under the Trump administration, funding for the program was cut by 84%, reduced down to just $10 million. Fortunately, the Biden administration sees the immense value of this program and has decided to allocate $80 million in funding to the program, which will be spread across the 30 states that use healthcare.gov. Next slide, please. So as I mentioned, the program was originally focused on helping people enroll in coverage on healthcare.gov, but over the years, the Navigator role has expanded to include additional services the Navigators generally provide, such as conducting community outreach to raise awareness about the availability of health coverage options, assisting people with Medicaid applications, providing health insurance literacy education so people know how to actually use their new health coverage, helping people find and connect with in-network doctors, and helping people overcome barriers they may encounter that prevent them from accessing coverage, including resolving data matching issues, filing appeals, applying for special enrollment periods, and so on. So essentially, over the last 8 years, Navigators have come to serve as incredibly valuable and trusted community resources for all things related to health coverage. Next slide, please. So you might be thinking to yourself, is my organization a good fit for this program and should I apply? Well, we want to encourage all organizations interested in helping your community get covered to apply for this grant. But we especially want to encourage organizations that are community-based organizations or organizations that work in or with communities of color and or other underserved communities and hard to reach communities, and also organizations that already have deep roots in their communities and are viewed as trusted messengers. Those are kinds of organizations are absolutely very much encouraged to apply because they're well positioned to build the Navigator program. And it's important to note that your organization doesn't need to have any experience providing enrollment assistance to be a good fit for this program. Free training and resources are available. So some examples of the types of organizations that have been funded in the past include food banks, health centers, legal aid organizations, community resource centers, Native American tribal organizations, and many, many others. Next slide, please. So my colleagues Tara and Carrie will discuss eligibility requirements for this program later in the webinar, but one key factor that determines whether your organization is eligible to receive funding is the state you intend to provide enrollment assistance in. So funding is only available for the 30 states shown in light blue on this map that use healthcare.gov. So if your state has its own insurance marketplace, you won't be eligible to receive Navigator grant funding in that state. So now I will turn it over to Asra Al-Hali from the Access Community Health and Resource Center, a current Navigator grantee, to provide some insight into their experience with the Navigator program.
Thank you, Ina. Hi, everyone. My name is Asra, and I'm a public health coordinator at Access. We're located in Dearborn, Michigan, and we are the largest Arab American community nonprofit in the nation. We've been serving the Metro Detroit community for over 50 years, and we offer a wide range of services, including social and health services. And although we are an Arab American organization, we don't just serve Arab Americans. We have over 140 programs that are available to anyone, and everyone can be accessed to any of the 11 locations across the Tri-County area in Michigan. Next slide, please. One of our most successful programs is the Navigator Health Enrollment Program. We have been assisting diverse communities with their health insurance needs since the first enrollment period. Our navigators are trained to provide these services in a culturally and linguistically appropriate manner. Many of our clients that we serve come from underserved communities, and many of them are low income or recent immigrants who do not speak English, and that alone puts them at a disadvantage, as they may not have adequate resources to inform them of the services they may qualify for, or may not have access or are not well versed in the use of technology to be able to apply for these services. And that's where our navigators play a vital role in educating them and increasing their knowledge of their health coverage options and answering any questions that they may have. In 2020 alone, we reached over 5,000 clients through our outreach and education efforts and assisted over 7,000 clients in enrollment and re-enrollment services. And despite it being a really tough year on all of us, it was still a very successful year, and we were able to assist nearly 4,500 clients virtually with their health insurance needs. Next slide, please. In addition to that, our navigators are that direct link that has established trust and continuously bridges the gap for racial and ethnic minorities to be able to access many of these services. And as you know, racial and ethnic minorities face many health system and even environmental barriers that disproportionately impacts their health and well-being. And this population specifically is disproportionately uninsured or underinsured. And as a consumer-facing organization, we have seen firsthand the barriers that racial and ethnic minorities face. And these barriers can be as big as financial or immigration issues, or as small as transportation or access to childcare services. That's where navigators play a critical role. They help facilitate access to these vital services and even go as far as tailoring these efforts to the needs of our community members, whether it be providing assistance in multiple languages or communicating it in a culturally appropriate manner. It all plays an important role, and it helps in addressing health disparities. And our navigators not only assist clients in gaining access to affordable health coverage, but they also help them remain consistently insured and help them understand understand the importance of prevention and preventative care. We connect them to resources and even make sure to help them choose a primary care provider that is near them for easy access, and educate them on the number of preventative screenings that are available to them. And that is one of the most rewarding aspects of this job, is that through our role, we are able to educate and empower them, and also equip them, with the necessary resources to be able to live a healthy life. Another really important aspect of our role is navigators that I wanted to mention is being that trusted messenger that clients can turn to for everything and anything, but especially when there's a policy being implemented that may affect or harm these vulnerable populations. Our navigators, who I should also mention, are representatives of the community. So these are folks who grew up in the community, and if I may use myself as an example, I immigrated here when I was 8 years old, and my family and I frequently visited Access for many of these services, including healthcare services. And this was long before the Navigator funding opportunity. But what I'm trying to say is that today I, along with many of my colleagues who are certified navigators, are a product of the Medicaid program. They are a product of the community health workers and navigator program. And we are representative of the community that we are serving and have lived through the similar experiences. And those experiences truly help us when assisting these vulnerable populations. So when we have these harmful policies, such as the Medicaid work requirements or public charge being discussed or implemented, we understand the fear and the chilling effect that it creates amongst our community members, and we make sure to address it and educate, our community members in a culturally appropriate manner, while also keeping health literacy and the language barriers in mind. And now I'm going to pass it along to Marianne Chung from Reimagining Collective. Thank you.
Hello and welcome. My name is Marianne. I'm with the Reimagining Collective. We are a collective of mission-driven Asian American strategists, organizers, coaches, evaluations, and designers reimagining for social change. So I'm based in Virginia with almost 20 years experience in writing grants for federal agencies, particularly CMS, CDC, HRSA, and SAMHSA, in addition to experience on the other end of administrating and running grants programs at a national level. So today I will share tips that I've learned over the years in hopes to help you put together a more competitive proposal for this opportunity. So next slide. Okay, so here's the $1 million answer immediately on the first slide, right? The top 5 ways to get funded are read the NOFO, read the NOFO, read the NOFO, read the NOFO, read the NOFO. And some of you may be asking, what is the NOFO, right? And that's the Notice of Funding Opportunity. So read that NOFO over and over and over again. This helps you to know what CMS wants and your guide to a successful grant proposal. I may still be old school, but I actually print it out. I add my highlights all over it, right? Because this will be your roadmap, your GPS, your true north in putting together a successful grant. Okay, so next slide. So putting together a federal grant like this within 1 month is no small feat, regardless of if you're writing this for the first time or you are a prior Navigator grantee. So some general tips again is to read the NOFO, the Notice of Funding. Outline the requirements. So make sure that you have a list of everything that needs to be completed for a successful grant proposal. There are many forms, many requests beyond just the narrative and the budget that need to be completed. And really, like, to wait till the last minute, it's a lot. Okay, develop a checklist and delegate responsibilities. So if your team is large enough, perhaps have one person in charge of the narrative, another person in charge of budgets and financial documents, and another person responsible for just collecting all of the attachments. FYI, CMS has provided you a checklist as Appendix 7 on page 102 of the NOFO. Okay, and finally, create a timeline and always plan for the unexpected. If I cannot emphasize enough now, is to start now. And really plan out the work. Now let's get into the NOFO. So next slide. So first, you need to know the dates. Okay, really, really important. The due date is July 6th at 3 p.m. Tuesday, July 6th at 3 p.m. Eastern Standard Time, not Pacific Standard Time, not Hawaii Standard Time, Eastern Standard Time. Please try to submit at least 1 to 2 days prior, just in case. If you're new to grants.gov, new to the federal grants submission process, definitely familiarize yourself with the grants portal as soon as possible. With federal grants, remember there's no option for late submissions. Okay, so 3 o'clock it closes, 3:01, 3:02 you cannot submit, right? So really plan ahead and try to submit earlier. Make sure that you attend the CMS-TA sessions. There's one today at 3 o'clock Eastern Standard Time that I hope you will attend. This is your opportunity to hear directly from CMS and to ask any clarifying questions to them related to what is in the NOFO. If you haven't already, your first priority would be to set up with the EIN, the DUNS, and the SAM requirements. This is on page 80 of the NOFO. All applicants under the NOFO must have an employer identification number, an EIN, or otherwise known as a taxpayer identification number. This process to obtain an EIN takes up to 5 weeks, okay? The application you must have a DUNS number and be registered in the SAM system. So you must register in the SAM's database in order to submit an application. And last but not least, create an account via grants.gov and start now if you don't have any one of these requirements. Okay. Next, I want to focus on the narrative, which is really the primary meat, right, and potatoes of the proposal, and provide you some insights on how I think through a process like a federal grant proposal. I'm coming from a place that I believe that you all are highly qualified to do this work and that these resources should go to you to support their communities. But oftentimes in applying for grants, our narratives just don't adequately highlight the amazing work and the work that we're doing in order to get funded. So let's change this, right? So let's go to the next slide, please. When looking at the NOFO, most importantly, I want to know what they're funding and, can I successfully fulfill it? Ina shared earlier the Navigator duties, right? And it's in the program requirements starting on page 9 of the NOFO under the program description. You see, I keep directing you to the NOFO to get familiar with it and to keep reading and rereading it. Your proposal should reflect your ability and intention to be able to do all 7 bullets in there. If you can go to the next slide. Okay, I know it's small, but this is the exact picture of what's there. There are seven, let's see, your proposal should reflect your ability and your intention to be able to do all 7 bullets. In the requirements is to conduct public education, to facilitate selection of QHP, to provide information that is culturally and linguistically appropriate, provide referrals, comply with applicable trainings, obtain authorization of applications for coverage, provide targeted assistance of service to underserved and vulnerable populations. My hint is use their words, right? So if you see, I think I'm on, I think I missed a slide, but that's okay. If you see on the first bullet, it would say conduct public education activities to raise awareness. This is it. Perfect. Thank you so much. So these are the program requirements, okay, page 8. These again are the 7 bullets, right, of what they want you to do, very clearly stated. My hint to you is to use their words. So if you see in the first bullet, it says conduct public education activities to raise awareness about the exchange. Many times people think that they have to be creative or they have to use different word choices than what is provided in the NOFO. And they may say something like lead outreach activities to educate people about the exchange. My suggestion is just to use their words, right? In the proposal, just say I will conduct public education activities to raise awareness about the exchange. Consciously and subconsciously, when the funder sees their words, they know that you're in alignment with their needs. And it makes it easier for us too, as the grant writer, just to use those words. So next slide. All right, so this is the slide that I was on prior. So from section 4A, which is the program requirement, the next important section that I would want you to look at is section D2. Okay, so this is where you will get a good understanding of their expectations of you and give you an idea of what to include in your proposal narrative. Then I would move on to section E, which is the application review information, the review criteria. So this will give you an understanding of how the proposal will be scored. Section E will be your play sheet on how to organize your narrative. So this is a highly competitive grant, and your ability to clearly and concisely lay out your work is critical. The bottom line is that the scoring is 200 points, and you need to get as close to 200 points as possible to be funded. Once the proposals are all scored, what they usually do is they'll rank all the proposals from highest to lowest. And for federal grants, many times what they will do is they will work down the list, right? And they will fund the groups until the money is all given out. So if your score is 200, more than likely you will be funded, depending on the number of proposals, the quality of the proposals, the money available. Sometimes even a 94 may or may not get funded. So I cannot emphasize enough, just answer the questions. Sometimes, again, people think they have to be elaborative and creative with their writing. And I'm here to tell you, just answer the questions, right? Follow it like a recipe so that the grant reviewer can provide you with the most points. In a reminder in the NOFO, it says that the grant proposal will be reviewed by an objective review committee. More than likely, the people who will be reviewing the proposals may be like you and me. We have other jobs, we have other projects, we have other priorities that we're balancing at the same time of wanting to be of service to this work. Remember, the grant reviewers are your internal advocates. They want to fund you, but you have to give them the information in a way that's well organized and easily understandable so that they can give you the maximum points for each of the questions. So answer the questions, and only the question that is being asked, and answer it in the place where they've asked you to put it. So don't have them look throughout the narrative, right, for the answers. Make it easy for them to advocate for you. So now let's look at the section D2, which is the content and form of your application submission. So if you could advance the slide, thank you. So let's look at section D2, the content and form of application submission. In this section, when I reviewed it, I see that there are 7 elements important to address in the narrative. Okay, so number 1, you can see in bold in the middle, is type of entity and description of the community or group the applicant expects to serve. In here, there are bullets and multiple sub-bullets that go into more detail of what they're asking, and they actually do align with the 7 requirements earlier discussed in A4. The other elements that they are requesting you to comment on is scope of activities, plan year 2021-22 program project goals, ensuring privacy and security of consumer personally identifiable information, accomplishments, and expertise of personnel. All of these sections will have a bullet and sub-bullet that break down in more detail what information is requested. Remember, make it easy. For example, in number 1, the first bullet says client must clearly specify whether they are a current or past HHS Navigator awardee or a new Navigator awardee. Okay, so in the very beginning of the narrative, I would clearly write, Reimagine Nonprofit is a new Navigator awardee. That's it, right? That's all you have to say to fulfill that one, and you can check it off. I get my points and I move on to the next bullet, right? That asks who will perform the Navigator activities. Next slide. This is still under element 1, okay? In this next bullet, right, applicants must also describe. So what I would do is I would have a bullet with the title Targeted Communities, and I would answer the question. I would have another bullet that says Targeted FFE State and County, and I would answer that question. Then the third bullet, I would add another bullet that says Percentage Expected to Serve of States Uninsured, and then I would answer the question. I hope you're seeing now, how I clearly organize and answer the questions given, right? I'm trying to make it easy for the grant reviewer. And for me, it's easier too to write as a grant writer than trying to think about how am I going to put this all in 3 or 4 paragraphs, right? In this section. Next slide. Okay, so we've gone through program requirements, we've gone through their more description of the narrative, and now the most important part in my mind is section E, the application review criteria, and this will be our place sheet on how to organize your narrative. Next page. Okay, so 20 pages, right? The narrative max is 20 pages again, so don't go over 20 pages, no 21 pages, follow it to the T, their instructions. From here, I see that in element 1, I can get up to 25 points for, remember the first element, which is the type of entity and description of the community or groups the applicant expects to serve. In this section, it's even divided up. They even divide up the 25 points by each bullet. Remember earlier I highlighted that the first one was clearly state at the beginning whether you are current or past HHS Navigator or new one. Make it easy for them to find the answer so they can just give you those 2 points and you move on, right? If you look at the third bullet, right, remember I went through this, applicant must also describe. You see that it's worth 13 points out of the 25 points. And within that, the first bullet, right, which was the target population, is worth 8 points. Okay, next slide. And then the 3 points goes to the description of the targeted FFE state or county. And another 2 point goes to your response for the question of percentage expected to serve the state uninsured population. I hope you're starting to see again how I, as a grant writer, would organize the narrative. Use section E as your outline for your narrative. Okay, sometimes there are minor discrepancies between the order that it was presented in the project narrative information in section D2 and the review scoring criteria in E2. And it actually, I went line by line to each of them, and some parts are do not align in the sub bullets, right? My advice to you is follow the reviewing scoring criteria in section E2, so this section, to organize your narrative versus what is in D2. If there is anything missing, I would just put it in where I see fit. But this is how the grant reviewer, or the grant reviewer will score you. So make sure you answer these questions, and so that you're getting your fullest points. Okay, next slide. Okay, remember, the grant reviewer is just like you and me. Make it easy for them. They can and they will be your biggest advocate when you give them the information, right? And sometimes the information for you, you think it's logical. I know it because this is what I do day in and day out, but really think about it from someone that is external to you. They're reading it for the first time, so make it clear and accessible for them to give you the points, right? And I know, and for me, it's starting from the understanding that you all are highly competent, and you should be getting this money because you're doing that work. Okay. So to help you plan out your real estate of the 20 pages, here is a tip. use the points allocated for each element and take that percentage proportion to know the estimate of how many pages to spend on each section. For example, the scope of activities is worth 75 points of the proposed 200 points, right? So I would take that percentage times 20 possible pages, and that estimates to be about 8 pages, right? So since the scope of activities is worth the most points of any of the sections that we have to comment on, I will spend the most pages there and most probably the most time, right, for me to fill out those pages in that section. I will not spend 10 pages on the accomplishments when the max I can get is 25 pages. Okay, so this is just merely an estimate for you to think about how you plan out the real estate of your proposal and knowing how much depth, or if you're going into too much depth in certain sections. Okay, next slide. So in wrapping up, remember to make it easy to read. Right? Make it easy for the grant reviewer to be your best advocate in this process. Comply with the fonts and formatting requirements. There are page limits for the budget justification, the narrative, follow that to a T. Have others review your narrative for editing. Remember to use the language in the NOFO, right? Read the NOFO, read the NOFO, read the NOFO. I actually look at keywords and I go back and I make sure those keywords are in my narrative at the end. And really make sure you highlight how your organization is different from the hundreds of others who will be submitting this application. Okay, so I'll be turning it over to Ina again to do the first set of Q&A. Thank you, everyone.
Thank you so much, Marianne. So as a reminder, if you'd like to ask a question, click on the Q&A box at the bottom of your screen and type your question into the box. So the first question is for Marianne. Can you confirm, is it 20 pages for the narrative and another 10 pages for the budget?
Yes, that's correct. It is in the NOFO. I think in the end and probably in the checklist, it lists all the page numbers.
And we just got another question. How many pages did you say again for the budget? I believe that was 10. Is that correct? Great. So a lot of questions about the slides and the recording. The slides and the recording will be available after the webinar. I'm going to put in the chat exactly where you can find them. So if anyone needs any additional advice or has questions, I'll also put in the chat where you can contact us. So the next question, how can we receive the information to derive the percent of the state that is uninsured? And that's for Tara.
Thanks, Ina. So we're actually going to have a link to that in one of the upcoming slides, but I'll give you a preview that there's a ton of data actually that they've released over the last several months that CMS has released that will be really helpful to you in breaking down not just the number of people who are uninsured in your state, but so much information about them, race, ethnicity, the language spoken in the home, their education, their occupations. So there is a lot of information and we have a link to that in just a few slides.
Thanks, Tara. And we've gotten a number of questions about which states are eligible. So again, in the chat, I'm just going to send a link to a map that shows which states are that use healthcare.gov. Only the states in light blue in this map are eligible for Navigator grant funding.
And Ina, some of the confusion might be that there are some states that use healthcare.gov, but that technically run their own state-based marketplace. Those are called SBM FP states. And in those states like Virginia, they have their own sources of consumer outreach funding. And so they would not be eligible for the federal Navigator funds, even though you are technically going to the URL healthcare.gov to enroll. So look closely at the map. There are 30 states. Those states are also listed in the NOFO early on where they have the allocations. That's starting on page 16. You can see if your state isn't listed, then you're not eligible for funds under this grant announcement.
Thanks, Tara, for the clarification. And another question for Tara, actually. Are nonprofit hospitals eligible to apply?
Yes, and I'm going to hold on that until we get to the FAQ slides that we have coming up.
Great. And does the Navigator have to be present in the state it serves, Tara?
That is, that's a tricky question. Technically, no. There's no physical, there's no strict physical presence requirement. And in fact, physical presence only gets you, I think, and Marianne might know off the top of her head, but I think it gets you maybe 5 points in the point allocation. So it's not given a high, given a high priority. However, certainly we know that physical presence is something that's really important to serving the community. So even though it has a low point allocation, I would say that it's a really important component of putting together your application, because if you aren't in the community, it's hard to serve the community. So I would keep that in mind, and we really encourage, this is why we are encouraging especially small and mid-sized organizations to take another look at the Navigator funding opportunity, because you are the ones that have the credibility and reach in your communities, and it would be, you can be the most effective. And so we really want to help equip you to compete for this kind of for these kinds of funds.
Thank you. And Marianne, this is a question for you to see if you can provide some insight into this. How do you decide how much funding to apply for when developing your proposal?
I think that's a tricky question, right? So I think, I would give it back to the person who posed that question, is how many can you serve, right? And what is reasonably the resources that you need to be able to do that work successfully. Really, it's dependent on you and your capacity. And to get back to the prior question, yeah, the last page on 102, the checklist lists all the maximum pages for each of the requirements.
Great. And Carrie, can you speak to whether community health centers that already have certified application counselors eligible, or are they eligible to apply for this funding?
Yes, you can apply for this funding if you already have certified application counselors. You just have some different requirements to become Navigator and different training.
Great. Let's see, we can take one more question. And then we'll have another Q&A session at the end. Can FQHCs be partners on this application, or is that a separate grant application, Carrie?
They can be partners. Their FQHCs do receive or can receive HRSA funding for outreach and enrollment activities, but they can be partners on this.
Thank you so much. So now I'll turn it over to Tara Straw to go into some FAQs.
Great, thank you. And thank you for the questions so far. We received a number of questions in advance, and so we are going to try to answer some of those in these FAQs. We've already hit a little bit on some of them. One thing I want to emphasize for this whole webinar is that we are not CMS. We are not the ones who are in charge of this funding opportunity. And so if you have questions, you shouldn't take it as if we have the final word, or as if we are the voice on this. We are reading the NOFO like you are. And so if you have complicated situations or some very detailed questions, please direct them to CMS. And we have in just a minute the web address, the email address to contact them. Next slide, please. So we've been talking about who is eligible for this award, and I just wanted to go into a little bit more detail. Ina talked at the beginning about community and consumer-focused nonprofits. I emphasized this in the one of the questions that we just went through. And, we strongly recommend that you all apply for this. As Marianne said, you are qualified, you are talented, you are respected in your community, and you deserve to have the funding that you need to continue to play that role in your community. And with so much more funding on the table, don't be discouraged if you didn't get an award in the last couple of cycles, because this is a new day. There's an 8-fold funding increase and a lot of new opportunities to come to the table, either as the applicant or as a partner of the applicant. So it's not just the community and consumer-focused nonprofits. It's also government organizations like counties, maybe county health departments, education organizations, public housing organizations, Indian tribes and tribal organizations, also for-profit businesses even can apply to be Navigator funds, can apply for funding through the Navigator award. So, the list is very broad, and the main requirement is that applicants have to demonstrate that they have existing relationships in the communities they would serve or could build those relationships. And that, for me, that goes back to the physical presence requirement. If you can't show that you have relationships in communities, or that you could build those relationships, some of that is really going to depend on where you physically are, or at least I would make a case that it does. And I would say if I have a physical presence, I would make a strong point of that in sections like this that are going to, because it's something that helps me demonstrate the strength of my relationships and the ability to build new relationships. You also should describe your past success in using those relationships and leveraging them to help your community, even if it's not in healthcare, even if it's not in a previous Navigator grant, just showing that you have relationships and know how to use them to advance goals. And you have to agree to provide information in a fair, accurate, and impartial manner. And all of those are on page 22 through 24. Next slide. So of all the people who are eligible to receive Navigator funding, it's a really extensive list. I didn't go through them all. There are some groups that are not eligible to receive Navigator funding. And this is really important to understand up front before you put time into a 100-page funding application. So an organization cannot be a Navigator if it receives any direct or indirect consideration from an insurer in connection with the enrollment of individuals or employees in a QHP or non-QHP. QHP is a qualified health plan. So if you're enrolling people in insurance and you're getting money from an insurer to do that, then that makes you ineligible for Navigator funding. And we've heard from some of you over the last week who say that you needed to take insurer funding because you were cut from the Navigator program, or your funding through the Navigator program was greatly reduced in a way that it didn't make sense to take the money. So if that's the case and you have supplemented with insurer funds, you'll really have to think about whether you're better off with those insurer funds or better off with a Navigator grant, because you can't have both if the purpose is for enrollment. And the words that I have italicized there are ones that are directly from the NOFO on page 25 and reiterated a few times in the FAQ document that accompanied this. There are a few narrow exceptions. So health providers who receive money from insurers only as consideration for services performed are still fine. So if you are a community health center and you bill insurers, and insurers pay you for services that are provided, that's fine. That's not considered under the definition of direct or indirect consideration. And so implicitly, and they don't say this explicitly in the Navigator announcement, but what you can what you can surmise from this is that funding from an insurer received for something other than enrollment in a QHP or non-QHP doesn't exclude you from Navigator funding. And if you have any questions about whether you are excluded from this opportunity because of your relationship with an insurance company or with a stop loss insurer, which probably is not relevant for you all, then we encourage you to contact CMS at the email address provided, navigatorgrants@cms.hhs.gov, because obviously these are, it is a huge decision of whether to put effort into this Navigator funding opportunity. We don't want you to feel, one, like we are the final word on this, but we also don't want you to feel, to have that question mark hanging over your head when you're deciding about whether this is the right thing for you. But we will note that every applicant has to include a statement in their cover letter that attests that they are not ineligible. And so even if you have never taken insurer money, never planned to, have no connection, haven't even worked in healthcare before, you still need to include a statement in your cover letter that attests that you're not ineligible. Next slide, please. So one big question, and this is just a preview of what Jody's going to talk about because she knows this better than anyone, is should we collaborate with other groups in the state or submit our own application? This is entirely up to you, but in deciding, you'll want to think about things like whether there is an existing coalition to partner with. I mean, maybe there's a really strong statewide group or local group that has had Navigator funding before, that's all gung-ho about this, that is ready to go. Whether your organization has the capacity to administer a federal grant, including reporting requirements, and Carrie's going to talk a little bit about reporting requirements in a minute, and whether you want to focus on a specific function like performing outreach instead of taking on the entire scope of Navigator activities. Navigators have to do a lot from start to finish on an application, but also doing lots of outreach, doing post-enrollment assistance. And so maybe you don't want to or are not really equipped to do everything under the scope of the Navigator role, but you can perform a specific function and perform it really well, in which case you might consider pairing with other groups to cover all of that ground and strengthen their proposal. Next slide, please. And we previewed this a little bit in the Q&A, but that we just had, but who is our target population? They list a number of potential groups that you can highlight as serving in your community. So uninsured and underinsured people, with a particular emphasis on certain underserved and vulnerable communities. These are just some of the groups that they highlight in the proposal. You can see page 24 for a complete list, but communities of color, rural communities, LGBTQ individuals, Medicaid eligible consumers who are not enrolled in coverage, but are eligible for coverage. And this is a group that has sort of come in and out of the Navigator role, but this is a very legitimate target group for you. Low income or homeless individuals, and other underserved and vulnerable populations in your community. So if you feel like there's a group in your community that isn't really represented by the list that CMS has put together in this application or in this award notice, you can propose your own group and have that approved by HHS through this process. And I mentioned data. Here is the link to get to a big old spreadsheet that has information not just by state, but by county and by metro region. So you can see all the eligibility demographics, who is, what's the percentage of people who are uninsured? Are they eligible for, what's their income tier? Are they eligible potentially for Medicaid or for premium tax credits? Are they primarily under 200% of poverty, 200 to 300% of poverty? All of these like fine points on who's eligible, and all of these points about who they are. So like I said earlier, their education, the industry they are working in, maybe if there's an industry that has a high uninsured rate, Maybe you mention that in your application and seek out a partnership with a trade group that represents that industry to strengthen your claim of reaching that community. So there's a lot of data that you can draw from. Obviously, don't let it distract you too much. Going back to Mary Ann's point of keeping it simple, but it can give you a lot of information, and it can help you make your point in the way that a grant writer wants to see you demonstrate what you are claiming in your application. So next slide, and I think, yes, I'm turning it to Carrie Rogers with Community Catalyst.
Hi, everyone. And I'm going to talk about a couple additional FAQ questions we got ahead of time. And the first is, what training and certifications are required for navigators? So all individual navigators must complete the HHS developed training program and then pass an online exam, which is through a system called the Marketplace Learning Management System. And this is something that is required on a yearly basis. You must have the federal certification before performing any of the navigator duties, and completion, as I mentioned, of the training and then subsequent recertification are required on an annual basis. You also must comply with any state-specific requirements within your state. So, for example, in the state of Missouri, there is a state-issued navigator license that you also would have to meet the requirements of in order to conduct your duties. And I've linked here where the current training information is for reference if you haven't been part of the program and you want to see kind of what that looks like. But a note here is that this is not the navigator training that new navigators starting for the 2022 plan year will have to complete, as that's not yet available and often comes online in August or September. So let's go to the next slide. What are the reporting requirements for this grant? So there are weekly, monthly, quarterly, annual, and a final report required. You can go to pages 67 and 68 of the NOFO to see the details about the reporting requirements. There are progress reporting requirements, which include things like how are your funds being used, program progress, any barriers that you experienced, how program ensured access to culturally and linguistically appropriate services, and then detail the measurable outcomes, which include how many people were served by your project. And then there's also financial reporting, which I'm not going to go into detail about, but you can go to page 68 of the NOFO again to look at that. And all reporting is submitted electronically, and CMS will provide you with all of the appropriate forms in order to complete and submit your reports. And they also provide technical assistance to grantees to help you to submit your reports in the appropriate fashion. You'll be assigned a program officer from CMS if you become a Navigator grantee, and they can help walk you through these requirements. And perhaps later, if people have questions about reporting requirements outside of this, one of the Navigator grant recipients on the call might speak to how big of a lift they feel like these reporting requirements have been for them. Let's go to the next slide. So how many cooperative agreements or grants will be awarded? CMS states in the NOFO on page 21 that between 85 and 120 cooperative agreements will be awarded across the 30 federally facilitated exchange states. Multiple awards can be issued for each state, and there's not a maximum number of awards that must be issued for each state. CMS, there's technically also not a minimum, but they hope to issue at least one. And as you can see by the number of cooperative agreements they plan to issue, that they hope to issue multiple per state. Let's go to the next slide. And what's the difference between a navigator and a certified application counselor, or a CAC? So a navigator is a trained, certified, and funded enrollment partner that agrees to take on a wide variety of outreach, enrollment, and post-enrollment activities. So navigators are funded through the Navigator grant program. And a CAC, or certified application counselor, is unfunded, at least unfunded by the federal government, and can focus on more limited set of activities, but still meet certain training and certification requirements. To operate as a CAC, your organization or group must be registered as a certified application counselor designated organization, which is referred to as a CDO. If you're interested in that, registration for new applicants is ongoing right now. But if you currently have a CDO agreement, you don't need to reapply. And there's a link here that provides information if you decide that you're not interested in the Navigator program, but would like to be a CAC. And I believe that is my last slide. And I'm gonna turn it over to Jody Ray from Florida Covering Kids and Families.
Hi, can you hear me?
Yes, we can.
Super. All right. Thank you. So I'm Jody with Florida Covering Kids and Families, and we've been the largest Navigator grantee in the country for most of the past 8 years. So and the key element of our initiative has been centered around these partnerships, which have been really essential to our consortium. And I think the impetus for this has been, we looked at what has really worked for us when we've done the CHIP grants. And I think one of the things that, for me personally, that I think is really important is that having some of the faces that, the front facing piece of this in these communities should reflect the communities we're serving. So it's so important to me that this is why we don't centralize it. We don't hire, all of the team and then send them out. So we engage both through informal and formal partnerships. So our consortium, which is called Covering Florida, is in the past, when we were fully funded, was comprised of 10 to 11 sub-grantees. And we really divided our state up into these regions. It looked at organizations that were serving the populations, particularly when we're looking at some of these hard to reach populations and vulnerable populations that we know we needed to serve and we needed to reach. And trust can be a huge barrier. So we were looking at organizations that we know are already serving these populations. So they're already trusted, communities are already reaching out to them for other things, and let them sort of be the face of this in those communities. They speak the languages, they know the demographics and the geographics of their communities. So that's been a huge piece of how we've structured this. And I think identifying those partnerships can be a little tricky sometimes, depending on, your relationships and your networking around your state. I think for us, because our organization has been doing this for more than 20 years, that really helped in been able to know who a lot of the organizations are around the state and how they're serving these different communities, and having those conversations around, whether they think that this kind of effort, this kind of work will complement what they're doing. So we're really trying to find organizations that can feel that this additional type of work, if they're not already doing something similar, will be in sync with their organization's already existing mission. So that's really important. We also spent a little bit of time trying to make sure that we understand the relationships that these organizations have in their community by talking to other folks in those communities. I think it's really important for the organization to have really strong relationships. We have divided the state up, like I said, mostly by regions, although we do have some, just few single county. Most of them are multi-county regions, and we look at how they have engaged stakeholders and other ways in their community. So do they have the ability to convene a local collaborative, a local coalition around this? And that kind of seeps into the informal partnerships, because while we subcontract under these formal partnerships, these key partnerships under the consortium, they then have, they might have other, partners that they either fund, but we all have that larger group of partners that, while they're not necessarily funded partners, they're essential to the work, the full collaboration in these communities. So, we look at particularly, are they working with those that are doing the enrollment work for Medicaid CHIP? We want those collaborations to exist in each of the regions. And it's real important that we are, we're assisting whole families. And I realize that under this grant, you can do the Medicaid and CHIP, but since some of us have both, we do the Medicaid and CHIP with those that spend a lot of time navigating our CHIP and Medicaid programs, which are very complicated in of themselves. So I think sometimes having folks that can focus on that has been really helpful. But looking at those formal partnerships versus the informal partnerships, again, we're looking at organizations at the local level who can not only understand the work itself. We're lucky that we've got sub-grantees that have been on since the first year. We have navigators that have been with us since the first year. So, I think that has been, very fortunate for us, because we've got some real strong history, expertise that can get shared across the consortium. And I think the structure of having a consortium has been great for other reasons, and that these partners who are managing these regions, they support each other too. So it's a real team effort to cover the entire state. We have, like I said, we have a lot of history that has been able to stay with our initiative, but also has allowed us to really, hone in on all kinds of vulnerable populations. Because when we're looking at a particular partner in a given region, looking at the demographics of that region, they can lean into what is the best strategies in that region. So one of the things that I think has made our initiative pretty effective is this idea that I do not believe that there's a one-size-fits-all approach that we can apply. And that's why I think individualizing this by regions has been really helpful, because I can tell you, for example, our Hispanic population in one area of the state is not the same in the other area. So to generalize and to try to use sort of a one-size-fits-all approach tends to be less effective than when you're really working with and taking into consideration, who the population is in that given area, because you're taking into consideration all of the things that may impact their ability to get healthcare or coverage. And so we really write a lot of this stuff into our grant. We really flush this out very specifically. Each of our regional partners submits a plan to us, their plan that is specific to their region, where they outline who their informal partners are, who their target populations are, and how will they reach, if they identify a certain population, how are they going to reach that? And their individual work plans all reflect that. Something else I would say that I think I was asked to address on a high level is, how do we manage that relationship with the sub-grantees? It's really helpful to have a couple of people who are on my team that work directly, report to me, that do contract management. There's a certain amount of this that definitely involves contract management, because we do a lot of monitoring the numbers. This is an ongoing activity of looking by Navigator, what their productivity is. So we track by Navigator for the entire state. And we use a system through Qualtrics that they import all their data, and then we can track, progress to goals, look at opportunities. If there's a deficit in goals, do we need to talk about an action plan to hone in on, addressing where there might be some deficits. And we have a lot of ongoing, we have a strong feedback loop. I should have said you could probably go to the next slide, but they both generally speak to the same things that I'm addressing, but they do monthly reporting. We have monthly calls with the whole consortium, as well as one-on-one calls to address individual concerns for a particular project. There's a lot of sharing back and forth. I think it's definitely a collaborative process. We manage a statewide line, and a lot of their calls come through that. So I would say, there's a lot that we keep track of for each of the grantees. And I think that's really important when you have sub-grantees. I think everybody has to have a certain level of accountability. Probably makes it easier for the feds, because we've got all of these grantees that could have been, potentially individual applicants, and we're managing that for them. And I think I think in some ways it's appealing, because we're making their job easier, and we're pretty meticulous about it. So I would say having internal systems like that, especially consistent systems, so everybody's kind of, you're doing a sort of an oranges, not an apple to oranges thing, but an apples to apples comparison. So they all use the same templates for their proposal. We're covering the same information, and but their strategies and their strategies and their vulnerable population, their populations that they're targeting, varies by the different communities. So that's where they decide how that's supposed to look and how that's going to be the most effective way to do that. So they tell us that. And then we work together to develop the metrics. Was there anything else I'm missing?
No, thank you so much, Jody.
Okay. All right, well then I think my job next is to hand it off to Phelan O'Neill. Phelan is with Young Invincibles.
Thank you, Jody. It's always great to hear from you. And I appreciate the introduction. My name's Phelan. I'm with Young Invincibles. I want to talk about our tool, the Get Covered Connector, and specifically how you can be using this and work with us to make part of your grant reporting a lot simpler. So if you go to the next slide. So reporting can be time consuming, but the connector makes it easier than ever. We've had over 600,000 appointments scheduled on our tool since 2014, and this is the leading tool in the nation for navigators in federally facilitated exchange states. The connector is one place to manage your schedules for assisters, to promote your availability so that you can share when and where you're going to be available with partners. It allows you to collect data and build reports, not just for CMS, but for your own internal analysis, things that Jody were talking about in terms of analyzing when and where and who are the most effective ways to get people enrolled. It also helps a lot with the data entry piece, because assisters are reminded by email to enter data from past appointments, and it will track everything you need for CMS reporting. So I want to talk about what that means for a second. So as we talked about a little earlier today, there are a number of specific requirements that CMS has detailing the outcomes of your work, making sure that, in essence, that we're all in this to serve people, and that we're reaching as many people as we can. Things about health insurance literacy and locating providers and enrolling in a qualifying health plan and how many people got tax credits and all these things. And the beauty of the connector, especially the beauty versus trying to build this yourself or do anything, is that it integrates everything seamlessly. So every week, every quarter, every time you need to pull a report, straight in the tool, you have the opportunity to download a new report with fresh data. You can customize it by your sub-grantees, something that Jody was talking about as sort of a consortium-wide view. You can break it down by individual assisters or different date ranges so that you can always get that customized report that suits your need. So this is why we strongly recommend that new navigators and returning ones who want a seamless, integrated way to make sure their schedules are up and managed and available for people to book appointments with, and to make sure that they have the data they need to quickly assemble CMS reports are set up for success. So if you go to the next slide, I want to talk about how you can learn more about the connector, and I want to make sure we have time for Q&A here. So the most important thing, one, this tool, the connector, is used by both of the navigators who've spoken on this call. This is something that covering Florida uses as well as Access. So the people you are hearing when they talk about how they run their programs, one thing to know is that they're using the connector, and both of them have been longtime power users of the connector who have run their programs using this tool effectively for several years now. So really valuable resource across the nation. And because unlike other potential areas you may be looking at to manage your schedules and manage your data, Young Invincibles is a part of this effort, right? This is one of our core focuses, is to help support the enrollment community and to make sure people get access to quality care. So our goals align with your goals, meaning that when there are things that change and you need help making the connector work for you, we are here to support you. We've done a lot over the past several years to adapt to wildly changing things. For instance, the global pandemic that forced people remote. We were able to work with the sisters to make that happen and to make sure that everyone had the support they need to handle remote assistance and to manage those appointments, even collect data on which appointments are going to be remote versus in person. So if this sounds appealing to you, I don't want to take up too much more time because I know we have a limited window here and there are still a lot of questions that need to be answered. My email is here. You can also fill out this simple form, bit.ly/connector2021, and we can be in touch. We can have a conversation with you all about what your needs are, your interest in using the connector, and we can go from there. The last thing I'll say, just as a friendly reminder, the connector is in fact free for navigators. We are not in this to make money. We are in this to serve your community. So in addition to making things super streamlined and having all of your CMS reporting requirements neat and tidy and packaged up for you, it's also a service you can use for free. And I think that's a really special part of what we give back to this community. So I'm going to put the link here in the chat. If you have any questions, feel free to reach out. Otherwise, I hope to hear from you all very soon.
Thank you so much, Phelan. Appreciate it. So we are now going to open up Q&A again. So the first question is for Tara. What kinds of training and resources are available for new navigator agencies?
Great. So there's a lot of training available. There is, of course, the CMS training that's available for navigators, and a lot of this covers kind of the nuts and bolts of navigator training, which Carrie talked about. There are also some additional kind of modules that CMS is working on that would offer supplemental training. And there are also sort of private or nonprofit trainings like the ones that we do through the Center on Budget and Policy Priorities Beyond the Basics program. We do a series of webinars that will walk you through really the eligibility process and some post-eligibility issues, like everything from the tax and income rules to appeals and special enrollment periods. So we offer that source as well. And I know that many of you are familiar with this because I know that many of you have participated in our webinars before.
Thank you. Next question is for Marianne. Would you do you recommend explaining what the CBO that is applying does in the proposal, and also how local, or is it helpful to include local detail about the area that the CBO is located in the proposal?
Yeah, so I would say answer the questions, right? So it does in the first element, which is type of entity description and community groups, like if they ask it, answer it, right? So I would see you being able to put it in there, as well as I would have to go back to the accomplishments. But if you were a prior Navigator grantee, then you most definitely should put your work in there. The question about the location of where you're at, I can see it being put into the portion of the states and counties that the population resides, and if your location is there.
Thank you. The next question is for Carrie. Does an organization that already has a CBO with CACs need to apply for the grant or submit a new grant application?
So if you would like to receive funding through the Navigator funding opportunity, you would need to apply and complete all the requirements in order to receive the funding.
Great. And Tara, is there only one award per state available?
Oh, I think Carrie covered this one. Do you want to take this?
Sure. There can be multiple awards per state. It is likely that most states will have more than one award, but it's not guaranteed.
And Carrie, one more for you. Is the training that you mentioned self-paced and completed on one's own?
Yes, it is. It's through an online system where you watch modules and then complete the online question exam portion and receive your certificate.
Great. And Tara, are partnerships or consortiums required in this project?
They're not required, but there's some information that you should take a look at if you are considering whether to be a part of a consortium or to put one together. Especially the lengthy footnote on page 23, which I was trying to parse through today, and then some other places I would Control F consortium in there. But you're not required to do it, but of course, you know, to really show that you're meeting the needs of your community, of other communities, especially if you're thinking statewide or for a larger area, the bigger the area, the more reach you need to show. And so, you know, it makes sense to have some strategic partnerships like the type of partnerships that Jody was talking about.
And Tara, if you are an FQHC and receive HRSA funding for outreach, can you still apply for Navigator funding?
Yes, there's no prohibition or conflict, and also applying for Navigator funding, and those groups are often well positioned to receive a Navigator award.
Thank you. And Jody, the next question is for you. Sorry, lost my question. Can you talk a bit about how you pay partner organizations and whether you cover their indirect costs?
Say that again, a little louder, I'm sorry.
Sorry, can you talk a bit about how you pay sub-grantees and whether you cover indirect costs for them?
How we pay grantees?
Sub-grantees and whether you cover.
Yeah, so they have contracts. We have subcontracts with them. So they invoice us monthly and we look at their progress. And we come through, you know, I work for a university, so, you know, we're a public entity. So, you know, of course, the university is really, they're really great because they've got, you know, they've got the resources to make sure that, you know, that we're coming through budgets, make sure things are in line with the proposed budgets, the funding, you know, things that you're allowed to spend money on, things like that. So every month, there's this meticulous process that we go through, and then, you know, based on what their expenses are, then we pay them. So, because every quarter doesn't look the same or every month doesn't look the same. We know open enrollment, staff ramps up, things like that. So there's, throughout the year, it varies what the subgrantee is needing to spend money on. And you had one more question that was attached to that. What was the other thing?
Do you provide indirect costs, covering indirect costs?
I'm sorry, I'm not understanding the question.
Indirect costs?
Indirects. Well, the grant allows for, if you have an indirect agreement with the feds, then that has to be provided, and that's what they can use for their indirect costs. They already have one in place. If they don't, the FOA states that they can ask for up to 10%.
Thank you. Tara, next question is for you. Is this funding more geared towards larger organizations serving thousands of people?
Oh, that's a tough one. I think that larger organizations obviously have more capacity to put together a funding proposal like this. Many of them also have broad experience doing it. And so for large organizations, there's no question that they have a leg up. However, given the number of awards that are possible under this grant, and given the increase in the amount of funding, also given a renewed focus on serving underserved populations, I think that creates some opportunities for some smaller, more targeted groups to make their way into this process and to get funded.
Great. And Phelan, next question is for you. Is the Get Covered connector free for CACs and CDO organizations?
Yes.
Great, thank you. And in order to access the connector and sign up, you can contact Phelan. Phelan, if you want to put your email address in the chat box. The next question is for Tara. If you're helping someone with a Medicaid application, is there any prohibition on helping them apply for other benefits, such as SNAP?
There's no prohibition in working with other benefits. There's no, that's not necessarily considered a funded part of your work. So I wouldn't be, and Marianne can stop me if I'm wrong, but I wouldn't put into your grants that part of what you want to use the Navigator funding for is to do all these other benefits. However, if you are already providing other benefits or helping people enroll in other benefits, I would think that this would go toward, establishing your presence in the community. But from a grant perspective, that's what I would assume. And from the practical perspective, there's certainly no prohibition on providing multiple services to a community in need.
And Tara, when you said that some organizations are ineligible, does that only refer to taking funds from private insurers for navigation services?
So the ineligibility rules, the primary group that is ineligible is insurance companies and people who receive direct or indirect consideration from insurance companies in the enrollment in a QHP or non-QHP, so in enrollment and insurance. So the question of for-profit or not-for-profit insurer, there are some complicated hospital system issues where it's a hospital system, but also an insurer. There are issues with how, like if an insurer or if a hospital system is a nonprofit, and they also have an insurance company and money is coming out of a community benefit fund, there are all sorts of complicated arrangements in some cases. And if you have a complicated arrangement with one of your partners or someone who is not even just you, but someone who you want to have on this cooperative agreement, then you should contact CMS to get a more definitive opinion on whether that funding conflicts you out.
Great. And Jody, the next question is for you. If you submit an application as part of a partnership with several organizations, which organization actually submits the application, and is one designated the lead?
I'm sorry, I'm having a hard time hearing you well, but I heard the last part is one organization designated the lead in the consortium.
Yes, and if you submit the application as part of a partnership with
Right.
several organizations, which organization actually submits the application?
In my case, it would be USF. We're the lead, and then they are and the rest of them are the sub-grantees. Yeah, and it clearly states in there has to be one designated lead, and so we intend to be the lead again for our grant.
Great, thank you so much. And let's see. The next question, I'll just open up to anyone. Does an individual who only does outreach activities and not individual consumer enrollment assistance, but is funded through Navigator dollars, need to take the federal exam? I think Jody.
I don't know how you get a Navigator grant if you're not doing enrollment, because one of the requirements is to do the enrollment, and that's a metric that we have to propose. So I don't know how to answer that. I mean, I think CMS is looking for enrollments as part of this.
Yep, and I think that they're, oh, sorry.
Oh, I was just going to say, I think that maybe part of the question is if you were, say, in a consortium and you were not the lead Navigator organization, but you were contracted to play a role, and your role was mainly outreach, and you would refer to others in the consortium for the other services. Do you need to take the Navigator training? And I think the answer to that is yes, that you have to. Yeah, thank you, Jen.
Yeah, to do outreach, you have to have completed the Navigator training.
You can't hold yourself out as a Navigator unless you've done the Navigator training and been certified. So it wouldn't work if all parties weren't considered Navigators.
All righty. Well, thank you all so much for the great presentations, and thank you everyone for your great questions. I will turn it back over to Aurora to close us out.
Sure thing. Again, we just want to say thank you. Important links are located here in the slide deck that will be sent out, but you can view the funding announcement on grants.gov. Don't forget that there are 2 CMS TA webinars. One is today in just a few minutes, and then the other is on June 28th. Next slide. And then lastly, there's going to be a recording of this webinar, and it's going to be available at healthreformbeyondthebasics.org. And also, please feel free to reach out to any of the speakers that you heard from today. We are all family and here to support you. So please reach out to any of the speakers that you'll see in the slide deck. Looking forward to seeing you all over at the TA webinar today, hopefully. And I hope you all have a good rest of your day. Bye-bye.